Welcome back to the Rundown Lab, where we break down and fact-check the biggest health podcasts. We know your time is valuable, but when you can, we always recommend catching the full episode. Links are in the description. What if the memory problems you're worried about aren't actually early dementia, but something far more common and treatable? That's one of the reassuring messages from a recent conversation between Peter Attia and neuroscientist Lisa Mosconi, and it's backed by solid science. In this episode of Peter Attia's podcast, Dr. Mosconi, who directs the Women's Brain Initiative at Weill Cornell, discusses lifestyle factors that influence Alzheimer's risk, with a particular focus on women's brain health during midlife. After reviewing the key claims, I can report this is a scientifically responsible conversation. Of the 8 major claims we examined, 3 were fully accurate, 3 were mostly accurate with minor caveats, and 2 were oversimplified but not misleading. Notably, nothing was false or seriously problematic. What they got right. Let's start with what the evidence strongly supports. Dr. Mosconi explains that cognitive symptoms like brain fog, memory lapses, and difficulty concentrating can often be attributed to menopause rather than early dementia. This is well-established science. The study of women's health across the nation, known as the SWAN study, along with other research, confirms these symptoms are common during the menopause transition. Estrogen decline affects hippocampal function, verbal memory, and processing speed. For many women experiencing these symptoms in midlife, this is genuinely reassuring information. She also states that Alzheimer's prevention is predominantly behavioral, and she's right. The Lancet Commission on Dementia Prevention has identified 12 or more modifiable risk factors that can be addressed through lifestyle changes. Currently, no FDA-approved drugs exist specifically for primary prevention in people without symptoms. Her discussion of managing cardiovascular risk factors is equally sound. Conditions like high blood pressure, diabetes, insulin resistance, and obesity are all recognized modifiable risk factors for dementia. The SPRINT MIND trial demonstrated that intensive blood pressure control reduces the risk of mild cognitive impairment. The connection between heart health and brain health is one of the most robust findings in dementia research. Where it gets more complicated. Now, some claims required a bit more nuance. When Dr. Mosconi describes the brain as built for stability, while the rest of the body is built for change, she's making a useful teaching point that oversimplifies the reality. Yes, the brain has unique features promoting stability. Neurons generally don't divide, we have a blood-brain barrier, and the brain enjoys a degree of immune privilege. However, the brain exhibits substantial plasticity throughout life. Synapses constantly remodel, and the brain physically changes in response to learning and experience. A more precise way to frame this is that the brain changes through different mechanisms and on different timescales than muscle tissue, not that it resists change entirely. Similarly, her point that it takes time to cause damage and time to build resilience is true for chronic neurodegenerative processes. Alzheimer's pathology does accumulate over decades before symptoms appear, and building cognitive reserve through education, exercise, and mental engagement is genuinely a long-term project. But this framing doesn't account for acute brain injuries. A stroke causes irreversible damage within minutes. Traumatic brain injury is instantaneous. So while her message applies well to the lifestyle-related neurodegeneration she's discussing, it's not a universal rule for brain health. There's also a small terminology issue worth mentioning. At one point, Dr. Mosconi refers to epigenetic mutations when describing how sustained behaviors create lasting brain changes. The core concept is sound, as repeated stimulation does drive structural changes and modifications to gene expression. However, the term should be epigenetic modifications, not mutations. In scientific terminology, mutations refer to changes in the DNA sequence itself, while epigenetic changes alter how genes are expressed without changing the underlying sequence. It's a minor technical point that doesn't undermine her message, but precision matters in science communication. Red flags. I'm pleased to report there were no red flags in this conversation. No claims were false or seriously misleading. This is genuinely responsible health communication from both the host and the guest. The bottom line. This episode earns high marks for scientific accuracy. Dr. Mosconi's core messages align with mainstream neurology and dementia prevention science. If you're a midlife woman worried about memory changes, the reassurance that these symptoms often relate to menopause rather than dementia is evidence-based and worth hearing. If you're anyone concerned about long-term brain health, the emphasis on managing cardiovascular risk factors and engaging in sustained healthy behaviors reflects current best evidence. The minor oversimplifications we identified are the kind of trade-offs that happen when complex neuroscience gets translated for a general audience, and they don't undermine the actionable takeaways. This is science communication done well.